So many of us have dealt with different levels of trauma during this pandemic, and now that the pandemic's over, we've experienced things that maybe we didn't realize were indications of trauma. So let's talk about it. Let's talk about pandemic PTSD, what it is, what we can expect, and how we can address it. Hello, my loves. Dr. Holly here. I have become somewhat of an expert on PTSD from my years of working with folks with trauma, working with veterans, my own experiences post Katrina, and with both friends and loved ones and myself. And now I am seeing a lot of those similar symptoms come across of folks who have been dealing with this pandemic. Initially in my work with first responders, and now more recently with folks as they are starting to adjust to post-pandemic life and what that means, and then what that looks like for them. They've had a number of maybe triggers from whether it be trauma that they've experienced due to the pandemic with losses or their own health issues, or previous traumas that are now being brought up because they've been kind of more in a stress state. So before I get into all that, like, what is PTSD? What is this that I'm talking about with trauma? So PTSD stands for post-traumatic stress disorder. It's something that when we look at diagnosing people from a psychiatric or mental health perspective, we talk about there being some type of traumatic event. Oftentimes it's something people can pinpoint to, but there are also incidents where maybe there's repetitive trauma, whether it be from some of my veterans who are coming over from Iraq and Afghanistan who've had repeated exposures, or someone who was sexually abused or physically or emotionally abused. There's also incidents of complex trauma where maybe there was a traumatic brain injury or some type of loss of consciousness where that what we would call like the incident isn't fully remembered, and that but yet you still have the symptoms of trauma. Symptoms include things like difficulty with sleep, whether it be due to a difficulty of like turning off your brain and going to sleep, or maybe experiencing nightmares. Hypervigilance, which means kind of checking doors and windows, finding yourself like really aware of where maybe the exits are, or whatever your trigger may be. If maybe you were in a motor vehicle accident, like super aware of your surroundings while driving. There's also an avoidance factor. So if there is something that you find triggering, maybe finding that you're actively avoiding those things, or maybe not even realizing that you're avoiding those things. Like, is there a part of the city that you don't go to because of what happened to you there, or an area of your house that you avoid, or what have you, whatever it may be, maybe certain relationships or certain types of relationships. There's also a level of maybe disconnect with those around you, with your loved ones, feeling like you're not able to have that emotional connection anymore, and just kind of feeling numb inside. So, like, what causes all this? What's the root cause of all these symptoms that we see with PTSD? When we look at that, there's a thing called the stress response. It's also known as the sympathetic nervous system kind of doing what it needs to do. With that, you have some type of stressor. Back in the day, it may have been like a Louisiana black bear or an alligator or what have you out in nature when we were kind of hunters and gatherers. And that stress response is triggered by that known stressor. So you have a hormone called cortisol, which rises in your body. That leads to increased blood pressure, heart rate going faster, breathing more deeply and quicker. Your blood is needing more oxygen, so all those things are happening, but it also needs more fuel. So you start breaking down glycogen, and with time, other parts or other areas of your body starts breaking down so you can have more glucose in your blood. So all those things kind of happen in the normal stress response. But with time, that can kind of go out of sorts, and either you stay elevated and completely stressed all the time because maybe you have a chronic stressor or an ongoing trauma that's kind of leading to that, or it kind of poops out because your body has just been elevated to a point that it can't really function. And then you start getting into that more like not being able to connect with people, having low energy, not a lot of motivation. So it can kind of go either way. And a lot of it is because your brain just isn't responding to the cortisol in a way that it once did. There's normally a feedback mechanism that allows for it to lower normally and let you get on with your day. And if that doesn't necessarily happen, then all these things can kind of go out of sorts. So what do we do? In traditional medicine, we talk about medication. We talk about things like the SSRIs, or serotonin reuptake inhibitors, because serotonin plays a part in regulating that anxiety and things that go along with PTSD. We also talk about sleep medications, or sometimes some of the traditional docs might try things like benzodiazepines or the atypical antipsychotics. Those latter two are actually contraindicated in PTSD. Those of us who are more versed in treating trauma have seen the studies and respond to that appropriately and kind of know that using a benzodiazepine in trauma actually adds to the avoidance factor. And then using those atypicals actually haven't been found to be helpful with the root cause of PTSD. And so can actually just add more side effects, more fuel to the fire, because unfortunately the trauma PTSD can lead you biologically to developing things like diabetes, as can the atypical antipsychotics. So that's why I study and practice integrative psychiatry, because believe it or not, the adaptogens and supplements that are available through Ayurvedic medicine and other areas of the world outside of Western world are super helpful for the symptoms of PTSD and help your brain from that root cause get back to a place where you're in sync. There's also a lot of power in the mind in mind-body medicine. So things like Tai Chi, meditation, yoga have all been found to lower the symptoms of PTSD and to be super helpful with that. There's certain acupuncture points that we can use either in full body acupuncture, or I myself practice auricular acupuncture. There's also a place for different types of therapy, whether it be the exposure therapies, things like EMDR, or whether it be more mind-body practices with meditation, body scans, art therapy, music therapy. All of these things can help reset your body and reset your mind and get you to a place where you're able to function and connect with the people you love, and they can feel connected to you in ways that maybe don't feel possible right now if you're dealing with some pandemic PTSD or PTSD from other factors. So if you're interested in any of these things, any of them kind of catch your eye or ear, please reach out. Please subscribe to my page on Facebook and on YouTube and Instagram, and reach out to me if you want to talk some more. For a discovery call, just check out my website, darawellnessnola.com, and we can talk about what's going on with you, talk about the different areas that I'm able to examine and provide some guidance. So with that, I send you all the love and care and good thoughts. Have a great day.